Ever wondered how the incredible journey of pregnancy begins? It all starts with a process known as ovulation, when a mature egg is released from the ovary and makes its way down the fallopian tube. Now, if there's a sperm cell waiting or on its way, a magical event called fertilization can occur. This is where the sperm and egg unite, creating a single cell with all the genetic information needed to form a new human being. This single cell, known as a zygote, then embarks on a journey to the uterus, dividing and growing into a small group of cells along the way. It's a journey fraught with challenges, but if successful, the zygote implants itself into the uterus, marking the start of pregnancy. This complex and intricate process is truly miraculous, revealing the wonder and beauty of life's beginning. And so, the thrilling voyage of pregnancy commences with the formation of a single cell. What happens during the initial 3 months of pregnancy? This is a question on many minds, and rightfully so, as it's a period of profound transformation, both for mother and baby. The first trimester is like the grand opening of pregnancy, where everything starts to take shape. It's a time of significant hormonal changes. The body starts producing more hormones like human chorionic gonadotropin, progesterone, and estrogen to support the pregnancy. These hormones are the architects, laying the groundwork for the baby's development and preparing the mother's body for the journey ahead. One of the earliest signs of pregnancy is morning sickness, which, despite its name, can strike at any time of the day. This is mainly due to the surge in hormones, and while it can be a bit uncomfortable, it's usually a good sign that the pregnancy is progressing well. The first trimester is also when the mother's body begins to change. Breasts may become tender and fuller, and the waistline may start to thicken. It's the body's way of making room for the new life growing inside. Now let's talk about the star of the show, the baby. The first trimester is a pivotal time for the fetus. It starts off as a tiny embryo, barely the size of a poppy seed, and embarks on a journey of rapid development. By the end of the first trimester, the baby has grown to the size of a peach. The baby's organs start forming, including the heart, which begins to beat rhythmically. Tiny buds appear that will grow into arms and legs, and the neural tube, which will become the brain and spinal cord, begins to form. This period is nothing short of miraculous. It's a time of unseen, yet momentous growth and change, both for the mother and the baby. And it all leads up to one of the most exciting milestones. By the end of the first trimester, the baby's heartbeat can often be heard, marking an exciting milestone. And with that, we close the chapter of the first trimester and open the next, ready to explore more wonders of pregnancy. Moving into the second trimester, what changes can a woman expect? Well, the second trimester, spanning from the 13th to the 27th week of pregnancy, is often considered the golden period of pregnancy. It's during this time that the baby bump becomes more visible as the baby starts to grow rapidly, marking an exciting time for the expecting mother. One of the most magical moments during the second trimester is the sensation of the baby's movements. Initially, these movements might feel like a flutter, a swish, or a roll. As weeks pass, these sensations become more distinct, as if someone is doing somersaults inside the belly. It's a unique experience that bonds the mother and baby in a special way. Let's delve deeper into the development of the fetus during this period. From the formation of facial features to the development of the skeletal system, it's a time of significant growth. By the 16th week, the baby's facial features become more defined, with eyebrows, eyelashes, and hair starting to grow. The baby's eyes can blink, and it might even start sucking its thumb. Meanwhile, the baby's skeletal system is also developing. By the 18th week, the baby's bones start to harden, a process known as ossification. This is also when the baby's unique fingerprints start to form. Simultaneously, the mother's body undergoes several changes. The baby bump grows more prominent, and there might be an increase in appetite as the baby requires more nutrition. There can be changes in skin pigmentation, and the mother might notice a dark line running from the belly button to the pubic bone, known as the linea nigra. As the second trimester progresses, the baby's movements become stronger, and by the end of the trimester, others might be able to feel the baby move by touching the mother's belly. It's an exhilarating experience that makes the pregnancy more real for everyone involved. By the end of the second trimester, the baby starts to resemble a tiny human, a thrilling prospect for the expecting parents. Indeed, the second trimester is an incredibly transformative period for both the baby and the mother. As the pregnancy progresses into the third trimester, what final changes occur? In this final trimester of pregnancy, the body, like a diligent artist, is putting the final touches to its masterpiece. The most noticeable change is perhaps the weight gain. As the baby grows and matures, it's not unusual for the expecting mother to gain around a pound a week. This is the body's way of preparing for the journey ahead, ensuring that both mother and baby have the energy reserves they require. Along with this weight gain, fatigue often takes center stage. The body is working overtime to support the developing baby, and this can take a toll on the energy levels. It's like running a marathon without leaving the house. But rest assured, this is completely normal and a sign that the body is doing exactly what it should be doing. As the baby grows, it starts to drop lower in the womb, a process known as lightening. This is the body's way of preparing for the grand finale, childbirth. It's as if the baby knows it's time to take its position at the starting line, ready for the race into the world. In these final stages, the baby is also undergoing significant changes. One of the most critical developments is in the lungs. These tiny organs are maturing, preparing to take their first breath of fresh air. It's like a diver preparing to surface, getting ready to swap the watery world inside the womb for the airy world outside. And finally, the baby begins to turn, positioning itself head down in readiness for birth. It's as if the baby is aligning itself with the direction of travel, ready for the journey it's about to embark on. As the third trimester concludes, both the mother and baby are prepared for the remarkable journey of childbirth. It's a time of anticipation, excitement, and perhaps a little anxiety. But rest assured, it's also a time of marvel as the body demonstrates its incredible ability to create and sustain life. Now, the moment we've all been waiting for, childbirth. What happens during this awe-inspiring process? The journey to childbirth starts with the onset of labor, the body's natural process of preparing to deliver the baby. This stage is characterized by regular contractions that gradually become more intense and frequent. As the body works tirelessly, the expectant mother may experience a myriad of emotions: anticipation, excitement, nervousness, and a sense of surrealness. Next comes the active labor stage, where the cervix dilates to about 10 centimeters, allowing for the baby to pass through. It's during this stage that mothers often feel intense pressure and discomfort. But amidst this, there's an undeniable sense of resilience and determination, a testament to the strength of motherhood. Following active labor is the transition phase, often the most intense part of labor. Despite the intensity, it's also the shortest phase, bringing the mother one step closer to meeting her baby. Now we come to the delivery of the baby, the moment that all the previous stages have been leading up to. With each contraction, the baby makes its way through the birth canal, and before long, the miracle of life presents itself to the world. It's an overwhelming moment filled with joy, relief, and an indescribable love. The baby's first cry, their first breath, these are moments etched in the hearts of the parents forever. But the process isn't over just yet. The final stage of childbirth is the delivery of the placenta. This often happens within 30 minutes of the baby's birth, marking the end of the childbirth process. Throughout each stage, the mother's body performs a symphony of tasks, all geared towards bringing a new life into the world. And the reward? A beautiful baby, the embodiment of love and hope, the culmination of 9 months of anticipation and preparation. And just like that, after 9 months of anticipation, the miracle of life makes its grand entrance. So, let's take a moment to reflect on the incredible journey we've just explored. From the wonder of conception, where a single cell transforms into a life bursting with potential, to the roller coaster of the first trimester, filled with both excitement and apprehension as the body begins to adapt to its new role. Next, we ventured into the second trimester, a period of growth and development for both mother and baby. It's a time of noticeable change as the baby starts to make its presence known. Then came the third trimester, the final stretch of the journey where the body prepares itself for the impending arrival of the child. The anticipation builds and the excitement is palpable. Finally, we arrived at the birth itself, the culmination of all the changes, challenges, and growth experienced throughout the journey. Pregnancy truly is a remarkable journey, full of changes, challenges, and ultimately, the miracle of life.